Thank you for joining us today for our monthly Create Your Best Life webinar. And I am Dr. Jeannie Hannon, the Program Education Manager for Time to Heal Cancer Foundation. And we are so excited that you joined us today for our session, Is My Home Cancerous? What You Need to Know. And it's my pleasure to introduce one of my friends and colleagues, Dr. Kiley Petersen. She is the core coordinator and assistant professor for the of Public Health Policy program at Nebraska Methodist College. That's where we are colleagues, where she brings experience in population health and health policy to the next generation of health leaders. Throughout her career, Dr. Peter Smith has been an advocate for health equity and community-based interventions. She is the co-chair of the practice committee and a member of the policy and advocacy committee for the Alliance for Nurses for Healthy Environments. And she also completed a fellowship program with the Climate Advocacy Group. So, Dr. Peter Smith, I am going to turn it over to you.
Hi, welcome everyone. It's a pleasure, and I first would like to know if you wouldn't mind entering into the chat where you are all located. It helps me. I'm going to reference a few places across the United States in my presentation today, and I know I see Tommy if you're in Pennsylvania. I'm referencing Chester, Pennsylvania later. But it's just helpful for me to know where you're located because that's the environment that surrounds you. Houston, Texas, awesome. California. Okay, I'm located in Omaha, Nebraska. So smack dab in the middle of the United States. And if you lose me today, it's because of the storms that are coming through. So hopefully that doesn't happen. But so as Jeannie mentioned, I am a nurse. A lot of my background has been in public health, but I also spent the beginning part of my career, I guess, working in pediatrics, working in trauma, emergency care, and in an ICU setting. And that is really foundational to where I am today. Working in the emergency setting, I saw very early on in my career how impacted our health and our injuries are by the environment that surrounds us. And it really has driven my passion for advocacy, for policy changes systemically, so that we can truly bring health to people before disease and illness and injury sets in. So that's where I am today. I did get the opportunity in 2019, which seems like yesterday, but it is not, to do a fellowship with the Alliance of Nurses for Healthy Environments. I'll tell you a little bit more about my story after we get into this, but I am a daughter of a farmer, granddaughter, great granddaughter. I'm the seventh generation farmer. So I've grown up in surrounded by nature and have a true connection to nature. My father actually passed away when I was 18 from renal cell carcinoma. And it was during that very short journey from his 3 months where he was diagnosed until he died that at 18 years old, as I was getting ready to go into nursing school, really started to look at what causes cancer. And that was in 2006. So we know a lot more now, 20 years later, than we did then. But just briefly, that's really where my passion truly started outside of growing up in nature and growing up with so connected to my environment. That was where my uh, passion for really looking at how do I live a life limiting the toxins that are surrounding me started. So then in 2019, I was able to do that fellowship with the Alliance of Nurses for Healthy Environments, and I was able to work with professionals from the Centers for Disease Control, the Environmental Protection Agency, the Environmental Working Group, uh, and really learn about how allergies and asthma and endocrine and reproductive disorders and cancers are influenced by what we're exposed to in our environment. And that just really reinforced what I had already kind of started seeing in as I was an emergency room nurse and was treating children on a daily basis for, asthma and allergies and all these things that were making them critically ill because of the environment that they lived in. So my goal here today is to create awareness. It is to do my best to condense what I have learned over the last 20 years into a 1 hour presentation. So I hope that I don't overwhelm any of you. I hope that I just create awareness and that I send you all off into your environments to kind of just look around you in a different light and know that I uh, am not as experienced. I've never been diagnosed with cancer, so I'm not as experienced in the cancer treatment, but I really am focused on cancer prevention and early detection. So my objectives today are to explain how the environmental factors influence cancer risk. I'm hoping that you're all able to recognize populations that are disproportionately impacted by environmental exposures, to identify common environmental risks in your home and community settings, and then to apply practical strategies to reduce your own risk and promote healthier environments. I just real quickly would like to take a poll. Do you think your home environment affects your cancer risk? Yes, no, or unsure. If you could just enter that into the chat. Perfect. Okay, that helps me just kind of gauge where you're all at. Okay, so why does this content matter? I think we now know that it's not just theoretical, that families in Nebraska and across our nation are exposed to environmental contamination without knowing it. And the health impacts of the environment are still unfolding. And really important to note that environmental risks are often invisible, but even though we can't see them, they're real. And we now have science to back that. So just to set the foundation for when I'm talking about environmental health and the environment, what am I talking about? And to put it frankly, I'm kind of talking about it all. So the everything around us shapes our health, right? It's the air we breathe, it's the water we drink, it's the food that we're consuming, but it's also the chemicals, the radiation, the microbes, and the physical forces that we all come into contact with. And it's important to know that our interactions with the environment are really complex and they're not always healthy. And I think we probably know that, right? We know that we're supposed to protect our skin when we go out into the sun. We know that, breathing wild fire air can be contaminating. Um, and those are things that we hear and see. And so we know that they're not always healthy, but there's a lot of things that we can't see that we don't know are surrounding us. And so the environment is a determinant of health, and it is a very complex one. And it's really in the last, I'd say, 5 years that I've started to see environment discussed in patient education, but even then it's not comprehensive. And especially when we're talking about the hospital or clinical setting, uh, there's not a lot that's being asked about the environment, even though it has a pretty big impact on us. So, from the air that we breathe to the water that we drink and the products that we're putting on our skin, the environment is permeated with harmful substances. I think it's, at least for myself, it was very easy for me to think that we had clean water and clean air and to take that for granted because we hear about how that's not the case for other countries around the world. But the reality is that we don't all have clean air and clean water in the United States, and the risks are continuing to increase. So, where we live matters. And especially in terms of population health, when we're looking at entire communities and comparing one community to the other, we're able to really predict life expectancy of individuals based on the zip code that they live in. And that science is getting narrowed down. We're able to compare zip code to zip code. And that's because the quality of our housing, our access to resources, the structures and the people and the stress that surround us are influencing our daily life. And so um, when I'm talking about environment, I'll be talking about it could be the lifestyle factors, so nutrition or tobacco and alcohol use, physical inactivity, those things that are traditionally mentioned when we're talking about clinical and hospital settings of what they reference. But it's also naturally occurring exposures, things like UV light, radon gas, infectious disease that the bacteria and viruses and funguses and molds that surround us. We have medical treatments that are in our environment that are affecting us, things like our radiation and our chemotherapy, our hormone drugs that are suppressing our immune system. But we also have workplace exposures, especially for those of us in healthcare. boy, are we surrounded with a lot of chemicals and things. Those of us who are administering chemotherapy and radiation and things are exposed through our workplaces. We have household exposures, which I'm going to go more into depth about, and then we also have pollution. And it's important to know that these invisible exposures can add up over time. And this is the paradox that we live in. In the United States, we spend $5.3 trillion on healthcare. It's a lot of money. We have some of the most advanced medical treatments, medicines, and supplements, uh, and we exceed the amount of money that we're spending on healthcare than other nations of similar size, but we're not well. Uh, we have much poorer outcomes when you're comparing the United States to other industrialized nations that are similar size and wealth to us. We have much poorer outcomes than those other countries, and we're spending more money. Um, and so we really need to think about why are we not well, um, and really think about the fact that not everybody has the same risk. Exposure is not equal. So, those of the individuals across the United States who may live in low income situations or live in poverty, that our income influences how and when we will access healthcare. It influences our transportation modes, it influences where we sleep at night and the quality of our housing and what jobs we're in, especially when we're thinking about how our jobs uh, expose us through our environment. Um, Risk is not evenly distributed across race and ethnicity. So that really stems back, if we look at environment, to neighborhood level redlining. I'm not going to go deep into redlining right now, but if you're not familiar with that term, I encourage you to really, there's online educational sessions that can teach you about redlining, but that's really from uh, in the early 30s. After the Great Depression, there was lending bias that went out to um, really promote people to gain home ownership. That was a way to encourage wealth and recover from the economic depression. But when lending loans went out, there was bias in who got the lending loans and where people were allowed to have homes. So white individuals often were given homes in healthy, uh, I guess, better parts of the cities. The cities were all zoned and on a scale of A to D. A and Bs were really great places where it was a better, I guess, termed better part to lend homes to. And C and Ds were the areas of the city that were more urbanized, that had more industrial pollution, that were less ideal. And uh, that those lending biases came out, and that white individuals 98% of the time were given loans in the A and B areas, and people of color at the time were segregated into those C and D areas. And so that's really the start of segregation. And with that segregation came concentrated areas where people were more exposed to that urbanization and industrialization. So I encourage you, if you haven't heard about that, please look into that, because we still see the effects of those decisions and those policies today. Uh, we are affected in terms of geography, right? Our physical situation, where we're located, if we're near industrial pollution, or if we're in rural Nebraska or rural United States where we're around agriculture more. Do we have green spaces located near us? Are we near fracking sites if you're in the South? So really, we know that systems shape our exposure, right? And there's people who are underserved, and there's people who are more vulnerable. Those are two terms that you hear, at least I hear in the population health world. Underserved really means that there's fewer services available. So rural Americans would be considered an underserved population because there's fewer primary care and specialty services in rural United States than there are in the urban areas. But then we have vulnerable populations as well who are more at risk for health because of social, economic, or political and environmental sources. So if I would like you to just see what you all enter into the chat, but if you had to think about the most critical window for vulnerability based on your age, who do you think is most at risk based on their age? Do you think it would be, infants, children, middle-aged, older adults. Okay, so I'm getting a couple of different answers, and it's kind of a trick question because there's several different periods of critical vulnerability. But the most critical window of vulnerability is actually uh, in utero. So before children are even born, as a fetus, our prenatal environment can expose our babies to chemical exposures. And these exposures can accumulate and then pass through both the umbilical cord as well as through breastfeeding. Uh, and uh, we also know that children are unique in terms of their vulnerability too, because they have higher metabolisms, they breathe faster. And so, with their higher metabolisms and they're breathing faster, they're going to metabolize and inhale a lot more content per their body size than we do as adults. Uh, we also know that their daily behavior is unique in that I don't walk around my yard and pick up dirt and put it in my mouth, but my 1-year-old sure does. So they come into contact with things that we as adults might not put in our mouths. And so they're just more at risk in that way. They also have a developing brain, right? And so if they're coming into contact with things like smoke or uh, air pollution, that can affect their brain more so well into puberty and adolescence. And then those of you that said older adults, you're also right in terms of they're vulnerable. And that's likely, it's more so due to the fact that the older we get, the more likely there is presence of other medical conditions. We do see physiological changes to respiratory systems. So people will start to breathe faster as we get older. We see weakened skin that becomes more frail. We also see people who are on more medications as they get older. So there can be some compounding effects because of those things. And briefly, I'm going to get into the meat of this, but this is all kind of foundational. Really important to know that those risks are all compounding too. Our health, again, I mentioned, is shaped by the zip code that we live in. Our zip code is a stronger predictor of our health and our life expectancy than our genetic code. I'll say that again. Our zip code is a stronger predictor of our health and our life expectancy than our DNA. So if we're ignoring where people live, if we're not thinking about where we live and what we're putting ourselves around, then we're really doing a disservice to ourselves. And for those of us who are healthcare providers, we're doing a disservice to our patients if we're not asking about where they live. You can kind of see in the background on this slide. I'm not going to go into detail on these maps, but these are all maps of Douglas County where I live. And these maps are all of different things. So one is looking at income levels, one is looking at lead exposure for children. One is looking at transportation and such. One is looking at redlining that happened in the 1930s. And you can see that a lot of those red and orange areas in those maps, they're overlapping. And that's because often across the United States, especially in urban areas, we see industrial pollution and old housing stock, poverty, redlining, poor access to healthcare. They're all overlapping in certain zip codes. And here in Douglas County, where I reside and where Jeannie is, we have a 12-year life expectancy gap in Douglas County. So from one zip code to another, it's actually in less than a mile radius. You can see one zip code is living 12 years longer than the other. And the zip codes where people are living shorter lives are more likely to have a lack of resources, have fewer grocery stores, fewer pharmacies. Transportation points are difficult, and we have fewer healthcare resources. And so this is really what I saw when I was working in the emergency department too. I saw more kids coming into the emergency room who were from areas that had more industrial pollution and more poverty, and it's really important to note that these are systems, like these are entire systems and policies that are shaping where people live. It's not just individual choices. And so we really need to start talking about this and recognizing this so that we can really help influence our neighbors' lives and our lives.
Yep. We had a comment,
Yes,
Kylie, that we can't really see the maps because the words are over the top.
yes. I didn't need you to see the maps specifically.
Okay.
I'll show you some maps later. This was more so just to know that when we're looking at maps, we're often seeing that comparing maps of urban areas, especially from one to the other, you can see the overlap.
Okay. Thank you.
And then one of the most common endpoints when we're looking at the health effects for any chemical exposure is cancer, right? Cancer is a result of changes in our DNA. And the DNA is our blueprint for our genetic code, right? And some of those changes can be inherited from our parents. We know about 5 to 10% of all cancers are hereditary, but the vast majority of cancers, that other 90 to 95%, are changes that happen during our lifetime as a result of environmental and lifestyle factors. And epigenetics is, uh, I guess, how our DNA is expressed. So it's a biochemical alteration to our DNA. And epigenetics, now that we have the study of epigenetics, it's really in the last 20 years we're learning more about epigenetics. It's really the study of that is now providing a causal link between the environment and the chemical changes to our DNA to then disease. And we're able to see that throughout our lifespans, we have more susceptible periods then. I mentioned that prenatal development and how important that time period is. We can also see that, smoking cigarettes, for example, we can see now with the study of epigenetics how it's changing DNA methylation. And we see that DNA methylation then resolve when smoking cessation occurs. Similarly, we see when we're drinking green tea, for example, the polyphenols in green tea, or if we're increasing our folic acid in our diet, we can see, positive epigenetic changes that happen with that can be associated with cancer prevention. And so the point here is that we're now finding that hard evidence that's not just correlating cancer to the environment. We're now finding there's some causation in that as well. That's really influencing where science is going. Uh, I'm in Douglas County in Nebraska. So in Nebraska, cancer is the second leading cause of death, but it is in the top 5 leading causes of death across the United States. Uh, and I know just maybe I'm just not always in the right spaces, but I feel like I don't have enough people around me saying, oh my gosh, why? Why is cancer surrounding us like that? We talk a lot about, well, let's just go get screened. Let's catch it early, go in and get your mammograms. But why are we not asking more and doing more in prevention and in true prevention, looking at our environment, doing a deeper reflection of why it's affecting some people more than others? Uh, Nebraska as a whole has significantly higher rates of the following cancers. So female breast cancer, melanoma, brain and nervous system cancers, kidney cancers, and colorectal cancers when you compare Nebraska to other areas around the United States. And a lot of that we're finding out is because of the agricultural practices that are practiced in Nebraska. Iowa is also very high risk, similar agricultural practices. In fact, I just saw an article that came through yesterday from the NIH that was highlighting the high instances of pediatric leukemia in Nebraska and Iowa because of our agricultural situations. And I'm just going to chime here. Okay, about halfway through. That's great. So as we talked about, the environment is complex. It's everywhere, and so are the problems. One of the problems is that there's just a lot that's unknown. There's new products that are being developed every day and put into our market, and we don't know until we know. Uh, and right now, there's a lot that we don't know. We do know that there's 86,000 chemicals that are in commerce. And I'm talking about the things that we're breathing, the things that we're putting on our skin, the things that we're using for cleaners, and at our jobs and in our houses. And we do know that, there is some regulation in terms of toxic substances. In 1970, the Toxic Substances Control Act was passed, and that is meant to regulate chemicals that are imported or manufactured in the United States, with the exception of pesticides, which are regulated by a different regulation company. The Toxic Substances and Control Act does not regulate tobacco or tobacco products, radioactive materials, food additives, drugs or cosmetics and medical devices. Those are all regulated by the FDA. So there's some gaps there, right? We know that 62,000 of those 86,000 chemicals were also grandfathered in, so they have not had the testing done that should be done to ensure that they are indeed safe. And we also know that there's no pre-market testing that's needed to be done in terms of like things that are in our uh, soaps and lotions and things. The FDA does not require pre-market testing. So, I could go out to my garage and whip up a lotion and go to a farmer's market and sell it and really not have to. Um, there could have, of course, be consequences if somebody said that's toxic and the EPA caught on and they tested it and after the fact regulated it. But there's little regulation to get things onto the market, is what I'm trying to say here. I think there's also a difference in what's considered to be safe and healthy and what's considered to be elevated or legal in terms of regulations. I'll show you in a little bit. We're going to work through a tap water database, and you can see that the health recommendations are far different than what is actually considered to be safe or legal, meaning there's a lot more substances and chemicals in the water that we drink than what we should have for our health. And we also see, I'm sure if any of you are listening to the news these days, almost every day it seems like there's, uh, federal lawsuits happening for one policy that came down the line, and there's lawsuits that are trying to prevent those policies from being changed. And so we see complex, very cumbersome administrative burdens. We see requirements to consider financial implications to industries who are actually putting the industry first, ensuring that we're not financially implicating them too much by putting regulations on them rather than protecting the health of our community. We see recurring corporate lawsuits that are creating these big roadblocks. It makes it really impossible for the EPA to regulate chemicals when we have all these complex and cumbersome burdens. I think that's really what I want to touch on there. So now we're going to just jump in real quick. We're going to talk about air pollution, water pollution, and then we'll jump into endocrine disruptors and get into the meat of things. So when we're looking at the environment and our health, it's important to consider a few types of pollution, I think. One of the biggest ones is the air we breathe, right? We can't live without the air. So globally, outdoor air pollution contributes to an estimated 4.2 million deaths around the world, and it's a top 9 factor for lost years of life. So we see about 1 in 10 people live in an area where air is not clean enough to meet the World Health Organization's guidelines. We also see that people who live in low income and middle income countries, those that cook with solid fuels in their homes, we know that homes where cigarette smoking or vaping is allowed indoors puts people at risk, uh, as well as people who live in floodplains or in regions with high levels of radon, i.e. Nebraska and Iowa. It's another place we've got high levels of radon that puts people at risk for lung cancer. Uh, we are also in a nation where 90% of where Americans spend 90% of our time inside. Uh, we've we've made these new houses that are really tight in terms of it's good for some things, but there's very little air movement that happens inside of our home. And so if we're bringing toxic chemicals into our home, then it's really sitting in our home. We're not getting that fresh air in and about. At the end of this presentation, I'm going to go into this Air Now. Hopefully, if we have time, I'll show you Air Now. It's a tool that you can use to monitor your outdoor air pollution and just kind of know when are good days to be outside and when are bad days to be outside in terms of air quality, especially for people who have lung disease or lung cancer or children who have asthma. It's important to monitor those air quality days. And then many of us don't have to think too much about where our drinking water comes from. We don't have to think about the infrastructure or the processes that are put into place to get us clean and safe water to our faucets. And we're really fortunate in the United States to have some of the most reliable and safest water systems in the world. But we do have aging infrastructure. We have gaps in our federal and state laws. We have land use practices like our agricultural practices where we're spraying pesticides onto our crops, and that's then going into our water and polluting our water pathways. We have industry that's polluting our waterways. And so while we're lucky to have, for the most part, clean drinking water, again, there's um, certain zip codes and certain communities that are more affected by not having clean drinking water, especially rural Americans who are on well water and they're pulling water directly from aquifers and more likely to be contaminated. So it's important that we think about our drinking water and what may be in it. You know, the crisis in Flint, Michigan in 2015 really heightened awareness about ensuring that our public facilities are ethically and responsibly taking care of the water that's coming into our faucets. Uh, and we're now getting more and more information about how our waters are being impacted by PFAS. If you're not familiar with PFAS, they're uh, a chemical, it's PFAS, it's a forever chemical, I guess, is used often in the production of plastics, but it is an endocrine disruptor that we're now correlating to kidney and testicular cancers and lots of endocrine disorders that doesn't break down in our environment. It's going into our waterways, it's in our water, we're drinking it, and we could be impacted by it. So uh, once again, there is a link here to the tap water database. I'm going to show you this at the end of our presentation just because I want to get through the slides, and then I'll show you all of these tools. This tap water database was put together by the Environmental Working Group, which is a group of researchers and health policy experts across the United States who have tested tap water across the United States and really looked at what's in our water and what can we do about it personally to ensure that we're drinking clean water. And then how many of you have heard of endocrine disruptors? No? Okay, a couple. Okay, excellent. Uh, so most people who have heard of endocrine disruptors think about how endocrine disruptors are used to make plastic, and that's true. Plastics are made of chemicals and fossil fuels. So I don't think a lot of people often I'll like have a plastic water bottle with me, but a lot of people don't think about how when you're drinking out of a plastic water bottle or you're holding a plastic reusable glass or you're putting your face lotion on, you're not really thinking about the petroleum and fracked gas, but that's what's used to make those products. In order for it to go from petroleum or fracked gas, they have to add an enormous amount of chemicals into that to give it its shape, to give it its color, to make it durable, and to help keeping it to make sure it doesn't burst up into flames. So those chemicals are added, and that's what creates then plastics. We know that phthalates, PFAS, which I just mentioned, that are in water, and flame retardants are added. And there's more than 2,400 documented chemicals of concern that go into the manufacturing of plastic and other products that are on our shelves today. And endocrine disruptors, not only are they used to make plastic, which is everywhere in our society today, but they're also chemicals that are being used to make pesticides. They're being added to our foods as food additives. They're added to our cosmetics, to our personal care products, and to the cleaning products that we use around our home. And again, as I mentioned before, these are largely not regulated. They're not tested before going on the market. They're only tested after if there's concern that they might be harmful. And we know that endocrine disruptors can enter the body through various routes. So they can enter our body through ingestion because we're eating them. It's in our contaminated food, like the plastic wrap that seems to come on every single food these days in our grocery stores. We know that it's in our water. It can come through inhalation if we're breathing in air pollutants or chemicals, especially if you live in a part of the United States where you have a plastic producing manufacturing site. They are polluting the air. It can also come into our body through dermal contact, so through our skin. If we're putting lotions that have phthalates or petroleum on in them, then we're putting them on our skin. And what we know about endocrine disruptors is that it's disrupting our hormones in our body. So it's leading to things like infertility. It's affecting our infants' birth weights. It's disrupting our thyroid hormones. It's affecting our cardiometabolic, so our heart and um, glucose regulation, diabetes, and things. It can affect our immune system, and we do have some increased risk of cancers as well. Uh, some of the endocrine disruptors that I'll just point out, again, there's thousands of endocrine disruptors that are in our system, but some of them that I think are very easy for you to just quickly read the ingredients list and get out of your home. If you have anything that has phthalate listed, phthalates are chemicals that are in a lot of personal care products and cosmetics. They're often added. You won't see phthalate on the ingredients list. What you'll see is fragrance. So if you have anything that has fragrance as an ingredient, that single ingredient labeled could actually be up to 4,000 different chemicals that are in that product labeled as fragrance. So that's one thing that I will say. If you have anything with fragrance on it, just get it out of your life if possible. Formaldehyde also can be labeled as fragrance. So I think many of us know that formaldehyde is bad, right? We've known that for a long time. It's supposed to be not in our products anymore, but we can still see it sneaking in under that fragrance ingredient. How many of you have heard of BPA? BPA used to be what plastic was made of, right? And now we see all of these BPA-free plastic products coming into existence, and we think that we're doing great. We're looking at our cans and making sure that it says BPA-free, and we're switching out our water bottles. About 10 years ago, I feel like it was this big thing. Oh, BPA is bad. Get it out of our water bottles. And so they started making plastic water bottles that on the bottom says BPA free with a circle around it. And um, guess what? They're making plastic now with BPS or BPFS, which is very similar in chemical nature to BPA. We are now finding that it's just as harmful, if not more harmful than BPA. So if I can tell you to do anything, is do your best to try to limit plastic because we just don't know what these plastic companies are, um, how they're changing their chemical infrastructure to keep making plastic.
And
Same with
like someone's,
Teflon.
oh, Teflon, yeah. And someone said nearly everything has fragrance in it.
Yes.
It's so scary.
Yes. And I know that this seems like doom and gloom. Every time I give this presentation, I'm like trying to get through these first several things to just bring the awareness. And then I do have key strategies at the end that I hope that you all can take into your life that'll give you a little power and agency. But again, I'm like, this is 20 years of my learning that I'm trying to really quickly throw at you. But the other thing is like Teflon. Remember Teflon? It was on all of our pans as a non-stick coating. And now we're getting Teflon-free non-stick coating pans. Well, guess what? There's still it wasn't necessarily Teflon. That was the issue. It was the nonstick coating that made up Teflon. And so there's still nonstick coatings. If you have pots and pans that have nonstick coating, I can't tell you for sure because the research is still coming in about how dangerous it is. But what we do know is that it's likely not any better. Um, yes, consider unscented products or consider products that may be scented with like real aromatherapy ingredients or essential oil ingredients. Okay, I'm going to just kind of buzz through a few more slides and then we'll get into the what can you do. So the human population has tripled since 1950, but our plastic production has increased 200-fold. And we are on track to triple our plastic production again by 2060. And I don't just mean like this is plastics that, yes, are plastic, like our plastic water bottles, our plastic trash bags, all of those things. But I'm also saying just the chemicals that are plastics that are added into things also counts in this. And half of the plastic that has ever been produced has been produced in the last 20 years. So we are all alive and can remember a time 15 years ago where we didn't have as much plastic that surrounded us as we do now. And I think that's a little alarming, but I think this is where there's some ground for hope here in that this problem is incredibly recent. And we can think back to 20 years ago, that was only 2006, right? It's very easy for us to imagine a world without this level of plastic, and therefore we can imagine how to get back to that, if you will. And so why are we making all this plastic now? Why are we putting all these chemicals into our products? Well, I briefly mentioned, but 99% of plastic is made from chemicals that are sourced from fossil fuels. And fossil fuel and the plastic industries are deeply connected. I think as renewable energy is becoming more affordable, electric cars are being more adopted, the fossil fuel demand is failing or is falling. Uh, but the current plastic market is worth hundreds of billions of dollars annually. And so the fossil carbon industry is really pivoting away from producing as much fuel for heat and transportation as they used to, and redirecting some of their investments into plastics and petrochemicals. So if I could put this simply, it's that plastic is big oil's plan B, right? It's how the industry is hoping to continue to make their money. Um, and this has to do with consumption, and it has to do with corporations expanding into the market and creating demand. Uh, which leads me to this slide. This is really the heart of the system that I think we all have the most power and agency in terms of citizens. The engine that drives the plastic production is the fact that we keep buying plastic. Uh, we are driving it. I think the industrial revolution was really great in that it was a boost for our economy that we so needed then. It created some really innovative processes, but it has also created an unhealthy environment for us, a polluted environment. It's convenient and it's consuming, but it is really an unhealthy environment, and we use so much stuff. So our the American economy's ultimate purpose is to produce more consumer goods, right? It's not to provide healthcare, it's not to provide education, it's not to provide safe transportation. It is to produce consumer goods 24/7. And our nation reflects that, and our health outcomes reflect that. And I just want you all to think about how all the stuff that we're buying that very quickly becomes trash. It either gets dumped into a landfill, which is ultimately just a giant hole in the ground, or if you're really unlucky, it gets burned first in an incinerator, and then it gets dumped into the landfill. um, but either way, it's polluting the air, it's polluting the land, and it's polluting our water. And not only are we getting exposed to these harmful chemicals through the initial production when they're getting made, if you're unlucky and live next to these plants, we're getting exposed to them when we're consuming them. And then we're finding them in our water and breathing them in our air when we discarded them. So it is like a trifold we're being impacted by these chemicals. Much of this is opportunistic. Again, I briefly mentioned this. We saw this through COVID with the pandemic. We had just prior to COVID, we had started seeing some strides where plastic bags were getting banned. We saw, companies were saying, we'll give you discounts if you bring in your own bags or if you bring in your own cups, and we can do refillables. And then COVID happened, and the plastic industry really took advantage of that to really push. Here's more single-use products. Even in healthcare, we see products that are single use now that we never had, like blood pressure cuffs are one time use, one patient, and then we throw them away. Like, why? Why can we not clean them? Right? Uh, Very opportunistic, and some processes really changed that through COVID that we really need to look at and maybe reconsider. And we've seen this before from other industries. The cigarette industry, we saw it during the lead paint industry, where even though we had all of this information about the dangers of lead, it was banned in other countries at the turn of the 20th century. We saw that here in the United States, company ads were encouraging people to paint their nurseries with lead paint so that toddlers' fingerprints could be easily dusted off. The same was true of toys, where the industry was claiming, like, these toys can be easily cleaned. We're putting lead paint on these toys. And so even though we knew the dangers of it, the industry was creating all of this marketing and campaigning to encourage people to consume it, and it works. Um, and we still see the impacts of lead paint today. That's actually an area that I work very heavily in, is really childhood lead poisoning and prevention, because still 100 years later, we're seeing the impacts. Okay, so what does it mean? We're gaining more knowledge about what it's doing. And I think at the moment, we know two things. We know that plastics and chemicals are endocrine disruptors. We know what they're doing in animal models. And we know what happens in animals happens in the human body for the most part. And we also know what endocrine disrupting chemicals are made of and the impact that those have on us. Uh, Back to where we started, right? We're not well. We're seeing this wave of non communicable diseases. Um, all 8 chronic conditions. So if you think about kidney disease, heart disease, lung disease, diabetes, cancer, depression, those major chronic diseases are at the highest rates that we've ever seen in history. And we know that there's several causative factors for that, right? It's not just it's not just endocrine disruptors, right? It's our socioeconomic status, it's our personal decisions, it's our access to healthcare. But we do know that the endocrine disruptors are a large part of it, and it's something that we have agency in changing. So, um, and here's just some from a public health, population health perspective. Uh, Often we think about, well, it's going to be so expensive to make these changes, but what's truly expensive is not making those changes in terms of the long term. If for every $30 invested in public health, sorry, we gain $30 for every $1 invested in public health. And so we know not only are we going to save money over time, but we're going to save lives and we can potentially save our future. Uh, over here on the left, here's a key takeaway. You'll have the slides after this, so feel free to take these as notes. I'm not going to go through these individually, but we know that history is not inevitable, right? We can solve the problems that we see. So one of the things that we can do is reduce our single-use plastic. When we reduce it, maybe we'll influence our neighbor or our friend to also reduce it. And we definitely see that consumer drives demand. Our demand drives the consumerism. So uh, I have celiac disease, and I'll tell you, 15 years ago when I was diagnosed with celiac, it was really hard for me to find gluten-free products, and now they're everywhere. And that's because there's been more demand for it. And so our choices every day, where we're shopping and what we're shopping for, will drive what's being produced, and that is because we are a consumer company. I briefly mentioned that my dad passed away in 2006. I was 18 years old. He was a Nebraska farmer. In 2006, there wasn't a lot of research to show the correlation or connection between pesticide use and cancers, but he died saying, I'm pretty sure it's from all of the pesticides that I was exposed to over my lifetime. And in 2020, actually, a large comprehensive study was released that showed 55,000 farmers and pesticide applicators were tracked. So they were tracked as well as their spouses across 5 different states for more than 25 years. And that study actually linked 4 specific herbicides and 2 insecticides specifically to increased renal cell carcinoma cancers. And that's what my father passed away from. So when that study was released in 2020, I was like, oh my gosh, he was right. He was right. 20 years later, we're now finding that we have the data to support it. Uh, I'm telling you a couple stories because I think stories, I've shared a lot of data with you, and I think stories help us remember things better. Um, we hear stories about rural Americans across the nation who are facing more health inequities. Um, and a lot of that has to do with their exposure to pesticides and other chemicals. Some of that has to do with their physical distance to healthcare and shortage of prevention services. Uh, Recently in my area, Harrison County, which is just about 40 miles from here, they were just in the news, Aaron Brockovich style, I think, doing their own community gathering because there's so many cancer cases in the area that they believe their well water is being contaminated from the Cold War missile sites, which are stored nearby. We hear stories. This was another story locally where we had an ethanol plant that had uh, a big spill of neonics, which is a uh, neurotoxin that is used to be sprayed on plants to help kill insects that are on the plants. Uh, this neonics treated corn had spilled onto the land in Meade, Nebraska. You can see this big green spot up here in this corner. Uh, I share this story to say that we don't know the health impacts of this. The neonics is now sitting on top of a very large aquifer and is likely going to absorb into the aquifer and therefore be in the water in the area. So there is quite a bit of public health efforts focused on the water safety of that area to continuously monitor it. Tommy, you're in Pennsylvania. I had the opportunity to go to Chester, Pennsylvania in 2019 when I was on the fellowship to do a toxic site tour. Chester is a population of about 34,000. It is a redlined community. It's one of the poorest communities in Pennsylvania, and they are home to the largest trash incinerator, a sewage sludge incinerator, a paper mill burning, petroleum coke mill, as well as many other numerous chemical plants and toxic waste sites. And Chester is known for its, they have a high lung cancer rate, which is 60% higher than the rest of Delaware County. They also have high exposure for their children to lead and low birth weights and many other compounding health implications that many environmental working groups believe is related to the industry that the individuals in this community are exposed to. And then I don't think we have anybody in Alaska, but in Alaska, this is Annie Aloha. Sorry, I had a brain fart on her last name was Annie Aloha. She was actually uh, lived in the indigenous community in Alaska. She had noticed as a community health worker and as a midwife herself, she had noticed after the Cold War that many of her community members were getting diagnosed with cancer. And she'd also been noticing a rise in the amount of women who were having miscarriages or low birth weight babies. And she was convinced that after the Cold War, the military had dumped thousands, like hundreds of thousands of fuel onto the native indigenous lands there. And she was convinced that whatever was in those barrels was harming her community. And so for 20 years, she tried to raise alarm to get the military to clean up and to study it. And before she actually herself was diagnosed with terminal liver cancer, and before she passed away, she actually sat with Dr. Pam Miller for a documentary called I Will Fight Until I Melt. And it's a really good documentary that really raised awareness and actually got the government's attention to do some cleanup in the area. I think those stories are just a few short stories to share that I'm sure many of you have your own stories, especially those of you who are survivors have your own story that connects you to the environment around you. And so I think it's important to know that we can, uh, first, we need to create awareness for the issue before we can then really take action around us to start making some changes. So I mentioned that like a lot of that is doom and gloom. So here's okay, let's take a deep breath and remember where we are. Uh, the real medicines. The things I'm going to show you here in the next couple minutes are things that are accessible, they're free, they're things that are culturally that our ancestors have been doing for years. They're effective, they do no harm, and they're all around us. And we now know, bonus, that they're evidence-based. We're now collecting research to say that the things we've been doing for hundreds of thousands of years can work. So these are some tangible steps specifically because most of the time after I talk about this, people are like, how do I get plastics and endocrine disruptors out of my environment? So these are some tangible steps. And don't feel like you have to do all of these all at once because this can feel overwhelming. Uh, but do your best. Instead of getting a coffee today at the coffee shop, take your reusable coffee cup with you. Take a reusable metal water bottle with you instead of a plastic water bottle, and slowly take the plastics out of your environment. Not only, again, are taking those plastics out of our environment good for our individual bodies, but it's going to create less consumption and less trash in our communities as well. So it's going to help our whole ecosystem, all the animals and birds and everything around us. Uh, if you haven't yet or don't filter your water, I encourage you to get a water filter. You can attach it to your faucet sink or have your water tested, especially if you're on well water. Avoid anything with fragrance. That's going to be hard to do at first. And don't feel like you have to go throw all your products away either. But when your deodorant runs out, next time you go to replace it, look at the ingredients on the back of your list. And I'm going to give you a resource here that is really helpful that you can take with you. If you have a phone, you can take with you and look up um, that the Environmental Working Group has put together to help people find cleaner products. Avoid nonstick pans, anything that has waterproof in it. The waterproofing is plastic. Anything that has stain resistant, anything in it is likely waterproofing, uh, or is likely plastic produced. So, you know, there's certain companies who produce a lot of workout equipment that are waterproof that I don't necessarily agree with, but stick to, cotton and wool and the things that are healthy for your skin and more comfortable, in my opinion. Avoid any artificial dyes in our foods. Reduce or eliminate cigarette or vape smoke exposure. Increase your ventilation in your house. So, use your bathroom fan and your cooking fan when you're cooking. Uh, and then if you can, HEPA filters on vacuum cleaners, those are a little bit more expensive, but they do usually last longer and help keep you healthier. So if when it's time to replace your vacuum, consider finding one that has a HEPA filter on it. And most vacuums are being produced these days with HEPA filters. Uh, and then make your own cleaning products, which might seem a little overwhelming at first, but I can promise you there's really simple, inexpensive ingredients. Like my grandma used hydrogen peroxide and water on her windows, and I started using hydrogen peroxide on my windows, and I've never seen them squeakier and cleaner. It's just great. And hydrogen peroxide is like $2. And it's you use just a little bit, dilute it down with water, works great. I remember my grandma using that, and then she would use newspaper to clean her windows. Um, you can make your own antibacterial spray with just a little bit of vinegar, like a fourth a cup of vinegar to 1 cup of water, put it in a spray bottle. It doesn't smell as great as these fragrant things that are on the market, but my nose has now trained that if it smells really good, it's likely not a good thing for my body. So vinegar smells for a couple seconds while you spray it on. Then once it dries, that smell is gone. Castile soap is really effective and non-toxic for cleaning things. Um, this is another thing too that I'm passionate about. Again, I mentioned I'm a farmer's daughter, so I'm very passionate about locally grown produce. Uh, so I'm maybe a little biased here, I will admit it. But if you can, reducing our exposure through locally grown food helps reduce the amount of plastic that we're exposed to. It is less processed, so we know what's in those usually. Most farmers are using less pesticides than our industries are using when they're producing massive amounts of fruits and vegetables. So even if it's not organic, if you're buying it locally, you're going to be exposed to less pesticides than buying fruits and vegetables from the grocery store. You're also supporting your community. You're financially supporting your community, but you're also supporting your community just by having conversations with your friends and community when you're buying those. And you're more likely to eat the rainbow when you buy locally, which we know eating the rainbow gives you all those polyphenols and antioxidants and things that are so beneficial for your skin in terms of helping your body fight cancer. Uh, we see blue zones around the world, like places like Greece and Italy, those Mediterranean places that have longer longevity, and largely that is related to their social environment. They're very close knit communities. They're eating, all of their daily habits are situated around community, and so we see just the big benefit of that. Same with this is a research that shows really how important community is for our physical health. Pennsylvania in the 1960s, there was some research that followed Italian immigrant communities, um, looked at their heart disease rate, which was 50% below the national average, despite the fact that they were smoking, drinking, and eating salami. Um, and that really was that they found that the secret ingredient there was that tight knit community and the bonds that they had. And when that community resolved in the 80s and 90s, we saw the heart disease rate very quickly rise to meet the national average. And ultimately, that's because their social fabric had changed and their health followed. And just remember nature is medicine as well, right? We hear about the importance of just being around green space, being around nature, learning from our indigenous community members and how connected they are to the land. Uh, and really, those few things can really support our body's natural ability, right? We have an amazing body who can do really great things if we support it and reduce our toxins to allow our liver and our kidneys to do what they're built to do, which is to get rid of toxins. And then I know we're at time. I'm sorry. These are the resources that I'm going to share with you all. I'm going to click on a few of these so that I can actually show you the tools. So the EWG is a really good website for those of you that are now like, oh, I need to look up all of my foods. Every year they put out a clean 15 and a dirty 12. The clean 15 are the fruits and vegetables that you can buy conventional if you can't afford to buy organic for everything. The clean 15 are the fruits and vegetables that have the lowest pesticide residue on them. The dirty 12 is what the EWG really encourages you to buy organic because they have the highest pesticide residue when you're buying them from the store. They also put out this the Healthy Living app, which is an app that I'm going to encourage you all to download if you have a smartphone. If you don't have a smartphone, you can go onto the EWG's website and go to Healthy Living, and you can type in almost any product. You can type in Dove soap or whatever product you might use, and it will show you what ingredients are in it. It will give you a color code. Green is great, red is bad. So you can just like kind of quickly glance at it. And then it will also, in the Healthy Living app, you can find alternatives. So EWG will actually verify some products that they have independently tested for how clean they are, I guess. It's a really helpful resource that I've used over the last 15 years to change a lot of things in my environment. I have to change my screen share settings for a second so that I can go to Safari and you can see all of my websites that I have pulled up here. Okay. I mentioned earlier the Air Now website. This is you can have they also have an app that you can put on your phone, but you can also just bookmark this on your internet. This is a really good daily air tracking monitor for where you are. You can put in Logan, Iowa, or you can put in Omaha, Nebraska, and it'll show you the air quality. When you start to see it in these orange, red, purple areas, it'll explain here a little bit more about why is it a poor air quality day. That's really important to monitor. I mentioned the EWG, so there's a few resources here. This is the website that does the Healthy Living app. They also do the Clean 15 and the Dirty 12. They also have this tap water database. So you can go to this website and you can just search your zip code. I'm going to put in my zip code. And you select your area. So my home currently is supplied water by Metropolitan Utilities District. And it will show you here that although I'm on public water, I have a lot of contaminants in my water. Arsenic is really common in Nebraska, Iowa because of pesticides. So are these. So you can see that this utility monitors at this, the legal limit is this. But the health recommendations are much lower. Like we would like to see the health limits a lot lower. So even though it's considered legal and it's okay for our utilities district to put this water out, it's still in high enough levels that we can see effects on our body from it. So I encourage you all, nitrites, again, this is common in rural areas because of the pesticide and agricultural practices that are put into it. Not only does it tell you what's elevated here, but if you scroll down, it'll tell you, how can I get it out of my water? So I'm far enough into this life that I have chosen to invest in a reverse osmosis machine for my sink. I started with a countertop one, which was like $200. And then saved up some money over time and have now purchased a reverse osmosis for my house, for my kitchen sink. But carbon filters are almost any water filter pitcher that you might have, or the filters that you attach to your faucet are carbon filters. So they're also really pretty effective. Um, I think also, if you click on these, it will tell you why are these dangerous. You can read the health risks associated with it. So if you're interested in that. Those of you that are clinicians in the area, if you want to just learn more about where you live, you can go to the Environmental Justice Index, which I have linked on my slides too, that I'll share with you. This is really looking at your social vulnerability and your environmental vulnerability. So I just put in here my zip code, and it pulls up a map similar to this. And so I can look at my community and just really see these compounding determinants of health. I can really look at on a social aspect in terms of what is people in my community, how are vulnerable are they in terms of poverty and housing and such. But then I can also look at my environment and see, am I close to industry? Am I close to an airport? How do those things put me at risk? And then it'll show you a little map. And this map very much echoes also the maps that I had in the background of that one slide that you couldn't see very well. But you'll see the highest risk zip codes here are very much overlapping those other maps that I had. And then those of you that are clinicians here as well, the Alliance of Nurses for Healthy Environments has a lot of environmental tools that you can use in your practice if you would like to start assessing somebody's exposure and just starting the conversation around what does their exposure look like. They have a lot of tools here that you can print off that are free and accessible. I think that is a lot of information. Is there any questions that you have? I'm going to stop sharing my screen so that I can see you all.
Kylie, thank you so much. I'm going to stop the recording, but please ask questions.